we have some handouts, I think. I think this, yeah. Representative Lehman, you're recognized to introduce your bill. Let's see, what number is it? 1355. 1355.
Thank you, Mr. Chairman. Committee. House Bill 1355, entitled Local Control Over Fluoride Levels, is a very short and simple bill. What this bill does is provide local control of fluoride addition to drinking water. It does not address the science of adding fluoride or the benefit of fluoride reducing cavities. There are many, many studies out there on both sides of this issue, so this bill does not address that. It does give local boards, cities, quorum courts, rural water systems the right to consider the science and to make a decision locally on whether or not they want to add fluoride to their water and at what levels they want to add fluoride to their water. Basically, the bottom line here is I feel that the people who drink the water should vote on or decide what they put in the water. The water quality varies from place to place. So when you're requiring a chemical addition to water statewide, the chemistry is different in different areas. So I think local people should look at that and make that decision. I say that based on my background as a water treatment professional. I've been over water treatment systems in Jonesboro, Fayetteville, Elkins, Little Rock, so I know the science of water treatment. So I really feel like that we should give local communities the opportunity to vote on this. That basically is the bill. I take any questions.
Members, you've heard an explanation of the bill. Representative Hammer, you're first for a question.
Thank you, Mr. Chair. A couple things. Number one, what this bill is proposing to do is to put it at the local level for each city or municipality or waterworks system to have a decision over whether they put fluorine in their water or not. Is that a fair assumption of the bill?
I think you said chlorine fluoride.
Or fluoride, sorry.
Yes, whatever the local entity is, whether that's a municipal system, a rural water system, whatever that local entity is, yes, that's correct.
All right, but they will all have to function according to what the state or whoever governs this puts out as far as the amounts, and I mean there's really there's not anything that's going to hurt anybody. It's just we're going to let the local level decide whether or not they want to do this or not. Is that correct?
That's correct. The Arkansas Department of Health has recommended a level. What this bill would do would allow the local entity to add fluoride from 0 up to that recommended level. So there would be a maximum level, yes.
Okay, final question. And how are the citizens that are part of a water system going to have a fair voice in deciding whether or not that fluoride is put in the water or not? Are they going to have an election process? How is it going to be determined by the board or the governing body of that water system? Can you tell us how the citizens are actually going to have input to that would make this bill do anything different than currently what is being done? Thank you.
Yes, Representative Hannah, that's a very good question. I thank you for asking that. Sticking with the theme of this bill, local control, I felt like it was better not to put that into this bill and complicate the issue even more. I believe if we're going to give the people at the local level the right to vote on whether to put fluoride in there, then they should determine how they do that. So it would be up to the local entity, whatever that is, a board, a city council, they could choose at the local level how they would like to do that. That is something that could be added to the bill, but again, if it's local control, I believe the local entity should decide that.
Do I have any more questions?